Imagine your smartwatch alerting you about a heart problem before your doctor even notices, or a patch on your skin tracking glucose levels without a single drop of blood. This isn't science fiction, it's the reality of wearable healthcare technology in 2025. From Apple Watches detecting atrial fibrillation to biosensors saving lives in real time, wearable tech is reshaping how we understand, monitor, and treat our bodies. Welcome to the future of medicine, personalized, proactive, and powered by data. You're watching Palm Health, where we explore the cutting edge of medical innovation and technology that's changing lives. Let's dive in. The rise of wearable health devices. Wearable technology has surged in popularity, but it's no longer just about step counts or sleep cycles. It's now deeply integrated into the healthcare system. According to a 2025 report from Deloitte, over 370 million people globally use wearable health devices, nearly double the number from just 5 years ago. This includes smartwatches, fitness bands, biosensors, smart patches, and even smart clothing. The market is massive. In 2024, the global wearable medical device market was valued at $40 billion, and it's projected to hit $64 billion by 2027, growing at a compound annual growth rate of 12.8%, according to Fortune Business Insights. But more important than the numbers is how this technology is changing lives. Real-time monitoring and early detection. One of the most transformative aspects of wearable tech is real-time health monitoring. Devices like the Apple Watch Series 9 or Samsung Galaxy Watch 6 can continuously track heart rate, blood oxygen, and even detect arrhythmias like atrial fibrillation. In fact, a Stanford medicine study in 2023 found that wearable devices detected 80% of COVID-19 cases in their earliest stages, sometimes days before symptoms appeared. Similarly, Fitbit's ECG functionality has helped users discover irregular heart rhythms they never knew existed. And Medtronic's wearable CGMs, continuous glucose monitors, have helped millions of diabetics track their blood sugar 24/7 without finger pricks. Devices like the Dexcom G7 and Abbott's Freestyle Libre 3 are FDA approved and used by millions. This real-time detection allows patients and doctors to intervene earlier, reducing complications and hospital visits. Chronic disease management wearables have become essential tools in managing chronic diseases, such as diabetes, hypertension, and heart failure. Let's take diabetes as an example. According to the International Diabetes Federation, over 530 million people globally live with diabetes. For many, CGMs have replaced painful finger sticks. The Dexcom G7 sends blood glucose data directly to your smartphone or smartwatch and provides alerts if levels are trending dangerously high or low. In the US, patients using wearables as part of remote patient monitoring programs have seen hospital readmission rates drop by 20%, according to the Centers for Medicare and Medicaid Services, CMS. That's a huge win for both patients and healthcare systems struggling with overloaded emergency rooms. Mental health and sleep tracking. Wearables aren't just helping with physical ailments. Mental health, stress management, and sleep quality are now core focuses. Devices like the Oura Ring or Whoop strap can detect changes in heart rate variability, HRV, a key biomarker for stress and recovery. These devices use algorithms to suggest when you need more rest, when you're overtraining, or when your body is under psychological stress. In a 2024 Harvard Health study, participants who used wearable tech to track stress and sleep experienced a 31% reduction in anxiety symptoms over a 6-month period. When combined with therapy and mindfulness apps, sleep monitoring, in particular, has taken a leap forward. The Oura Ring and Fitbit Sense 2 can distinguish between REM, light, and deep sleep, offering daily feedback and insights. For people with insomnia or sleep apnea, this data is often shared with sleep specialists for more accurate diagnosis and treatment plans. Post-surgery and hospital recovery. Hospitals are now leveraging wearables to speed up recovery and reduce readmission. After surgery, patients are often discharged with a smart patch or wearable device to monitor heart rate, temperature, and movement. One example is Current Health, a remote monitoring platform used by the Mayo Clinic and other hospitals. In a recent clinical trial, it helped reduce hospital stays by 22% by enabling doctors to monitor recovery remotely and in real time. Similarly, Philips's wearable biosensors, which continuously monitor patients' vitals, are being used in over 100 hospitals worldwide. The goal is to free up ICU beds while still keeping a digital eye on patients who might be deteriorating. Emergency alerts and fall detection. For elderly users or those with mobility issues, wearables have become literal lifesavers. Apple's fall detection feature has become one of its most underappreciated tools. When a user falls and remains immobile for more than a minute, the watch calls emergency services and sends a location to preset emergency contacts. Since its launch, thousands of lives have been saved, including a 78-year-old woman in New York who suffered a stroke alone at home and was found within minutes after her Apple Watch dialed 911. Beyond Apple, devices like Medical Guardian and LifePhone have created wearable pendants with GPS tracking, medication reminders, and instant emergency access tailored to older adults who want independence without sacrificing safety. Data-driven personalized healthcare. Perhaps the most powerful shift is the rise of personalized medicine. With data collected from wearables, doctors can now build customized treatment plans based on your actual lifestyle and vitals, not just lab results from once-a-year visits. Imagine your cardiologist seeing your heart rhythm over the last 90 days, not just during a 10-minute appointment. Or your endocrinologist tweaking your insulin dosage based on your daily activity and glucose trends collected via wearable. This shift to data-rich healthcare makes treatments more precise, preventative, and patient-centered. AI integration and predictive health. The next frontier is combining wearable data with artificial intelligence. Already, platforms like Fitbit Premium, Apple Health, and Garmin Connect use AI to offer predictive insights. For example, if your resting heart rate spikes overnight or sleep quality drops, suddenly your device might recommend taking it easy or even seeing a doctor. In clinical settings, startups like Bioformis are using AI-powered wearables to predict heart failure weeks before symptoms occur. Their FDA-approved device and platform are currently being used in the US and Asia, with incredible results. Hospitals using Bioformi have reduced unplanned readmissions by 38%. Privacy and ethical concerns. But with great data comes great responsibility. The rise of health-focused wearables also raises privacy concerns. A 2024 Pew Research study found that 62% of users are concerned about how their health data is stored, who can access it, and whether it's shared with insurance companies or employers. HIPAA regulations protect patient data in clinical use, but consumer wearables like smartwatches don't always fall under the same protections. In response, companies like Apple and Google have updated their privacy policies, offering users more control over what is shared and stored. But the debate continues. The future, implantables and beyond. Looking ahead, wearable tech may soon evolve into implantable tech. In 2025, researchers at the University of Texas unveiled a graphene-based biosensor thinner than a human hair that can be implanted under the skin to monitor glucose and dehydration. Meanwhile, MIT is working on smart tattoos that could change color based on your hydration level or blood sugar. And Elon Musk's Neuralink, though still in early stages, is pushing the boundary between wearable and neurological interface. Wearable tech is no longer just about convenience. It's about changing the way we deliver healthcare. In just a few short years, wearable technology has gone from step counters to life-saving medical tools. Whether it's helping diabetics monitor glucose, alerting users of heart issues, tracking mental health, or predicting hospital readmissions, the impact is undeniable. We're entering an era where your body talks and your watch listens. The question now isn't if wearable tech will transform healthcare. It already has.